Hello my dear friends. Now we are moving towards another important concept in head and neck. We are now going to discuss about all the blood vessels which are important for your head and neck aspect, guys. Now in head and neck, we all know very well there will be the artery which is actually supplying here will be the common carotid artery, and that common carotid artery will be actually going up, giving a branch external carotid artery, and it will continue as your internal carotid artery. But for now, this discussion here, we don't have to worry about the internal carotid artery, and that we have discussed actually in detail in neuroanatomy. Why? Because that is actually involved in the formation of circle of Willis, supplying the blood to your brain. So in head and neck topic here right now we are actually going to concentrate on external carotid artery, and apart from external carotid artery, we are going to discuss about the facial artery, and then we are also going to discuss about the maxillary artery, and after all this we are also going to discuss about the subclavian artery, guys. And associated along with this one, I am also going to teach you the relations of scalenus anterior muscle. That is what we are actually going to discuss in this blood vessel section of head and neck part, guys. These are all the blood vessels which are important for your exams. So let's get started first of all with the external carotid artery. Let's begin with the external carotid artery right now, guys. Now we all know very well, needless to even say, it is a branch of which one only? External carotid artery is actually a branch of common carotid artery only. So it is a branch of common carotid artery. Perfect. We don't have to worry about that. And this external carotid artery will be in turn giving you totally like 8 branches. Fine. Now for artery always we have to learn what only? We have to learn the branches given by that. An external carotid artery will in turn give you how many branches, guys? Totally 8 branches. And let us write down the names of all these 8 branches here, and don't worry, I'll make you learn it now itself. I'll tell you a trick here how to remember them. So first start writing all the branches along with me. Number 1, first of all, there will be a superior thyroid artery. There will be a superior thyroid artery. Number 2, you will be having a lingual artery. Lingual artery. And then number 3, there will be a facial artery. Even facial artery also is a branch of external carotid artery only, and we have to learn about that in detail, guys. And number 4, the most important one, there will be ascending pharyngeal artery. Ascending pharyngeal artery. And here you got to be like really careful. Why? Because somewhere else you will also come across ascending palatine artery. So don't get confused between them. Here it is ascending pharyngeal artery, guys. And then number 5, remember occipital artery. Occipital artery. And then number 6, there will be the posterior auricular artery. Posterior auricular artery. And then number 7, remember here the maxillary artery. And lastly, finally, the end one will be the superficial temporal artery, guys. Superficial temporal artery. Perfect. So these are all the 8 branches of external carotid artery. Better you just write it once along with me, guys, so that instead of just simply mugging the list, let us just write once, and so that you'll be able to remember them more nicely. So there are totally like 8 branches of external carotid artery, and what is the way, sir? What is the trick? How to remember this one? Now there is some mnemonic and all that you might have seen in your first year MBBS, guys. I don't even remember the mnemonic. Sometimes the mnemonic itself is very much dangerous when compared to the concept. Some powdered face, puffy and all. Don't worry about that mnemonic and all. The best way, apply that on your body. So try to do it along with me wherever you are studying right now. External carotid artery will totally give 8 branches. How to remember this one? First of all, external carotid artery will give a branch to thyroid gland, and it is given from above or from below? From above. So therefore it will be superior thyroid artery. Number 1, the first one, first branch there. Then there will be a branch to the tongue here, lingual artery, and then to the face there will be facial artery. So just what you do is you just keep on going up, okay? So superior thyroid artery, then the lingual artery and the facial artery. Now little bit above, it will be actually giving a branch to your pharynx also, guys. Now try to remember like this here, external carotid artery on one side, external carotid artery on one side, and the pharynx in the middle over here, and it is giving the branch to the pharynx towards the medial side. And that is the only and only one branch of the external carotid artery which is a medial branch. I'll tell you the importance of that later on, don't worry about that. Ascending pharyngeal artery. Now little bit above, there will be 2 arteries given behind. One is occipital artery here, and another one is posterior auricular artery behind the auricle. And then a little bit above, yes, the external carotid artery will be ending, terminating by dividing into two branches. One is maxillary artery, another one is superficial temporal artery. That makes all the branches of external carotid artery easy for us. Perfectly done. So never try to learn with the help of a mnemonic or something like that, guys. The best way to learn, apply all that 8 branches on your body here. Let us do it very quickly again once more. Superior thyroid artery, then the lingual artery and the facial artery. Ascending pharyngeal artery, then two behind, occipital and posterior auricular artery, and then finally terminating, ending by dividing into two branches, the maxillary artery and the superficial temporal artery. That's the best way to learn all the 8 branches. Now, once you are done with learning part, now the next thing is, what will be the MCQs possible here? What are the MCQs which are possible here, guys? Out of all these 8 branches, which will be the terminal branches? Terminal, like external carotid arteries ending by giving rise to 2 branches, that is maxillary artery and superficial temporal artery. These two are terminal branches, guys. Okay, and there is no great science in that. External carotid artery is terminating by giving rise to these 2 branches, terminal branches, number 7 and number 8. Now, out of all these branches, which will be dorsal branches, which are given behind, and the name itself is telling you occipital artery and posterior auricular artery, these two are dorsal branches of external carotid artery. They are dorsal branches. And then I told you the trick already here, external carotid artery on both the sides, and remember the pharynx in the middle, and therefore ascending pharyngeal. Just a trick to remember that one, guys. Ascending pharyngeal artery is, yes, towards the medial side. So it's neither ventral, dorsal or lateral, it's actually the medial branch. And that is the only medial branch of external carotid artery. That is the only medial branch of external carotid artery. And then try to understand the location, the thyroid gland in the front, the tongue in the front and the face in the front. So therefore superior thyroid, the lingual and facial, all the 3 branches are coming in the front. So these 3 branches which are left out here are the ventral branches of external carotid artery. Perfectly done. Like this is the one category of questions that they can ask you in the exam. Like out of all 8 branches which are terminal, the dorsal, ventral, blah 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 blah. Anything else? Yes, there is one more question asked in the exam. Out of all these 8 branches, which is the first branch of external carotid artery? Remember, the superior thyroid artery is the first branch. It is the first branch of the external carotid artery. And one more MCQ which is possible here, out of all the 8 branches, which is the largest branch? And the largest branch of external carotid artery will be maxillary artery, guys. We even have to learn about the maxillary artery in detail. Remember that maxillary artery in turn will giving rise to 16 branches. That's the largest one. External carotid artery is giving like 8 branches. Out of that 8, the largest one is maxillary. Why? Because maxillary artery in turn is giving rise to 16 branches. We are going to learn that. That is one way of remembering. I'll tell you another way of remembering. For the people who love to remember with the help of mnemonics, yes, look at all the 8 names, the name which is having max in that one, it's maxillary artery. The name of the artery which is having max, that's the only one, maxillary artery, and max, the largest. So largest branch will be maxillary artery. You will never forget in your lifetime, guys. Now apart from that, one more method, one more way of asking the questions in this topic is, they'll be asking you the branches of external carotid artery with respect to the triangles of neck. So in the triangles of neck, already I have discussed there, okay, you'll be actually having the carotid triangle here. I hope you remember the very important one, the carotid triangle here. So there will be posterior belly of digastric, the sternocleidomastoid muscle here, and superior belly of omohyoid, carotid triangle. And just above this one here will be the digastric triangle. So you have got carotid triangle, and this one here is the digastric triangle. Perfect. And if you see behind the sternocleidomastoid here you will be actually having the posterior triangle of the neck. That will be posterior triangle of the neck. So with respect to the triangles, they'll be asking you certain questions like which branch will be present in which triangle. And for that, let me make you actually draw a diagram, and the things will become easier with respect to the diagram. So imagine this one here to be the posterior belly of digastric, and this one here to be the sternocleidomastoid muscle, and this here will be the superior belly of omohyoid. Superior belly of omohyoid. And I'll just write it in short here, guys. Posterior belly of digastric, and this one is the superior belly of omohyoid, and this one here will be your sternocleidomastoid. There is a reason why I'm writing the names like this. Please write it exactly like that only. Why? Because we have to write down the names of all the branches now, and I don't want to clutter this diagram here, guys. So between them, what is the name of this triangle? This triangle will be actually the carotid triangle. This triangle here will be the carotid triangle. And behind the sternocleidomastoid, no doubt about that, this entire thing here will be the posterior triangle. So behind that, you'll be actually having the posterior triangle here, the posterior triangle of the neck. And above the carotid triangle there will be a digastric triangle. So just imagine this one here to be the digastric triangle, guys. So this one here is the digastric triangle. The best way to imagine this diagram, or to understand this diagram, is on our body here. So carotid triangle, there will be sternocleidomastoid. Behind that, this is the posterior triangle, and above this one here will be the digastric triangle, guys. Perfect. Now we need to understand which branch of the external carotid artery will be present in which triangles. Why? Because later on, when you learn about the triangles of neck, contents of that will become damn easy for you people, guys. Now first of all, imagine here this one to be the common carotid artery, and common carotid artery will actually in turn give a branch, that is your external carotid artery over here. So this one will be the common carotid artery, and this is actually the external carotid artery here, and this here will be actually internal carotid going inside, but I'm not going to continue with that one. Let's focus on our topic right now. Our topic is external carotid artery. Now external carotid artery, first of all, it's giving a branch, the very first branch, that is superior thyroid artery. That's the first branch of the external carotid artery, that is superior thyroid artery, going to the thyroid gland. And then it will also give a branch, that is your lingual artery to the tongue, and then the facial artery, going to the face, guys, the facial artery. And all these three are ventral branches. So you just imagine this diagram is like a side view here. And in the side view, external carotid artery is giving like superior thyroid, the lingual and facial. Those three branches are ventral branches, guys. And if you are looking at the diagram in the side view here, if this is your external carotid artery, where should be the ascending pharyngeal artery, the next one, ascending pharyngeal artery. Ascending pharyngeal artery has to go to the pharynx on the medial side. It is a medial branch. So it has to go towards the medial side. So you just try to understand this one as your ascending pharyngeal artery. I'm drawing in dotted lines. Why? Because it is towards the medial side. So this one is ascending pharyngeal artery. Perfect. I'm done with the ventral branches. I'm done with the medial branch. Now we'll come to the dorsal branches, guys. Now further moving up, the external carotid artery is moving up here. Now while moving up, it will be giving one dorsal branch here, that is occipital artery. And then it is also giving like one more branch, and this branch here will be the posterior auricular artery. That is posterior auricular artery. And last and final thing, after giving those two dorsal branches, the external carotid artery will be ending. It is ending and dividing into two branches here, and those two branches will be the maxillary artery and superficial temporal artery. So superficial temporal artery, the maxillary artery and superficial temporal artery. Perfectly done. Now let us see like what are the arteries which are present in which particular triangle here, guys. So out of all these 8 branches, which arteries are present in which triangle? Let me just give the numbers over here, the same number that I have used there. Superior thyroid artery, then the lingual artery and the facial artery. Number 4 we have written there as ascending pharyngeal, and then number 5 occipital artery, number 6 the posterior auricular artery, and then the maxillary and the superficial temporal. All these are the 8 branches. Perfect. And now just look at the diagram and answer what are the arteries or how many arteries are present in the carotid triangle, guys. And you can clearly see right from number 1, number 2, number 3, number 4 and even number 5. Superior thyroid, the lingual, facial, ascending pharyngeal and even occipital artery. All these arteries are present in the carotid triangle. And later on when we are going to study about the triangles of neck, and that will be the content of the carotid triangle, and that is made easy here itself, guys. Perfectly done. Then now what are the arteries which are present in the digastric triangle? In the digastric triangle, you are able to find the lingual artery, which is moving up here guys, and even the facial artery as well as the posterior auricular artery. So posterior auricular artery, the lingual artery and the facial artery, all these are the arteries present in the digastric triangle. But whereas what about the maxillary and superficial temporal? Don't get confused there. The external carotid artery is moving up and there it is actually giving rise to the maxillary artery and superficial temporal artery. So therefore, which arteries are found in the digastric triangle? You will be able to find the lingual artery, number 2, and the facial artery, number 3, and even the posterior auricular artery, that is number 6. So all these are the arteries present in the digastric triangle. Now please focus on occipital artery, the last and final point here guys, occipital artery. Occipital artery is not only present in the carotid triangle, from the carotid triangle it is actually going behind the sternocleidomastoid, and behind the sternocleidomastoid you will be actually having the posterior triangle. So remember, the posterior triangle, there you will be able to find the occipital artery. And guys, if you study this with a little bit of patience over here, that is the reason why I am teaching you a little bit slowly here, telling you slowly here. If you study all these things a little bit with patience here, then the triangles of neck, which is supposed to be one of the difficult topic for students, will become easy. Slowly the things will become easier guys. Perfect. So that is about everything related to the external carotid artery, like all the 8 branches, their like ventral, dorsal, terminal and medial branches, and then the first branch of that, the largest branch, maxillary artery, and then which branches are present in which triangle of the neck. Perfectly done. So that completes about the external carotid artery. Now after this, what we are going to do is, we are going to learn about 2 important branches of external carotid artery. One, we need to learn about the facial artery, and another, we actually have to learn about the maxillary artery. And out of these 2, let us first of all learn about the maxillary artery guys. Let's learn about the maxillary artery. Now whenever you are learning about any artery, always make a habit of first of all writing that it is a branch from where. Remember, maxillary artery, it is a branch of external carotid artery. We have seen it just now. In fact, it is the largest branch of external carotid artery. Now the important thing is, the maxillary artery, it is divided into 3 parts, and it is divided into 3 parts by a muscle, and that muscle is lateral pterygoid muscle. It is divided into 3 parts by lateral pterygoid muscle, and that is something really important. I think the same concept we have learned at many places in anatomy guys. Number 1, I'll try to recall in your mind, upper limb. In upper limb we learned about the axillary artery. Even axillary artery is also divided into 3 parts, and that is divided into 3 parts with the help of pectoralis minor muscle. Similarly, now we are learning about the maxillary artery, that is also divided into 3 parts with the help of lateral pterygoid muscle. And similarly, even subclavian artery is also divided into 3 parts with the help of scalenus anterior muscle. It's kind of same concept. So try to remember that which muscle is dividing is important there. So maxillary artery is divided into 3 parts with the help of which muscle guys? Lateral pterygoid muscle. Now what is the next thing that you have to remember here? Whenever you learn about any artery, the thing that you have to learn is branches. And here you got to learn the branches given from first part, the second part and third part one by one. So let's first get started with the branches of maxillary artery. And that too, let us learn about the branches given from first part of the maxillary artery guys. Now the first part of the maxillary artery will totally give 5 branches. And these branches guys, in this there is not like much concept for me to explain you, or it is not like some conceptual thing to be said. It's about only the branches here, and we have to memorize those branches. And to memorize those branches, yes, now actually you have to learn that with the help of certain mnemonics. Our first part will totally give 5 branches, and most of the students love to remember with the mnemonic as MAID. Normally the spelling of the MAID will be M-A-I-D. We are adding like one more A there, MAID. Now in that MAID, M stands for what? Number 1, M stands for middle meningeal artery. Middle meningeal artery. I would love to tell you that, while writing, why I am telling you slowly here, while writing itself, repeat that names in your mind and try to memorize them. It's about the branches and you got to memorize them. So first part will give you middle meningeal artery. Number 2, A actually stands for accessory meningeal artery. A for accessory meningeal artery. Then one more A there stands for anterior tympanic artery. anterior tympanic artery. And then number 4, I stands for inferior alveolar artery. Inferior alveolar artery. And finally in MAID we have got deep there, and the D stands for deep auricular artery. Deep auricular artery, guys. So that is the 5 branches given from the first part of the maxillary artery, MAID. Now why these branches are important and why do you have to learn about this one? Try to correlate right now. In the very beginning of the head and neck topic, guys, the very first topic that we have learned, the cranial fossae and foramens. And in cranial foramen, I hope you are able to recall, middle meningeal artery is the one which is going to pass through a foramen, and that foramen is foramen spinosum. So it is the one which is going to pass through foramen spinosum. I hope you remember that middle meningeal artery passing through foramen spinosum, and along with that even there will be a nerve, that is nervus spinosus, passing along with that. Fine. And one more thing to tell you people here, for example, if this is the foramen spinosum here, guys, and passing through that we'll be actually having the middle meningeal artery. There is one more way how to identify that one, middle meningeal artery. There is one nerve which is actually encircling the middle meningeal artery, and that nerve which is encircling the middle meningeal artery will be auriculotemporal nerve. That's extremely important, and it's really important for you to identify in an image. So nowadays it is a latest trend in your exams, they are giving images, and that too even cadaveric images also. So if it is given in the cadaveric image, how to identify artery encircled by auriculotemporal nerve, that artery has to be definitely middle meningeal artery, guys. So that's your middle meningeal artery. And one more thing, I hope you will be able to correlate, even there is a clinical aspect here. If this artery ruptures, it will obviously lead to hemorrhage, and it will lead to epidural hemorrhage, epidural or extradural hemorrhage we can say, guys. Perfect. Now the next one, accessory meningeal artery. I hope it is striking in your mind already. Accessory meningeal artery is the one which is going through a foramen, and that foramen is known as foramen ovale. And there is a very famous mnemonic for this one, male. We have seen this a lot of times in the cranial nerves when we studied about the cranial nerves. So in male, A stands for the accessory meningeal artery. So that is passing through the foramen ovale, guys. And after that, I don't want you to worry about anterior tympanic artery and deep auricular. Yes, they have something to do with your ear. Auricular and tympanic, both of them are supplying the blood in the ear to external acoustic meatus as well as the tympanic membrane from the outer surface as well as inner surface, guys. And what about this inferior alveolar artery? Inferior alveolar artery is the one which is going along with the inferior alveolar nerve. Try to recall. The cranial nerve number 5, trigeminal. Trigeminal, that is 5-3, that is mandibular nerve. And I hope you remember, mandibular nerve will be actually dividing into 2 divisions, anterior division and the posterior division. Posterior division will in turn give you 3 branches, and I asked you to remember that with the mnemonic as ALI, A-L-I, I for inferior alveolar nerve. So now why I am trying to recall all this in your mind is that the inferior alveolar nerve and the inferior alveolar vessels are actually going through a foramen on the medial side of the mandible. So if this is your mandible here, on the medial side there is a foramen, and that foramen is actually the mandibular foramen. And what is passing through mandibular foramen? It's inferior alveolar nerve as well as the inferior alveolar vessels. This has been recently tested in the exam. Perfect. So if this is your mandible over here, for example, I'm just drawing a small diagram here. There will be like head of the mandible, the neck of that, and the conoid process. For example, if this is the mandible over here, guys, on the medial side there is a foramen here, and through this foramen the nerve, the inferior alveolar nerve as well as the vessels also, inferior alveolar vessels are also going to pass through this foramen, and that foramen is referred to as mandibular foramen. This foramen here will be mandibular foramen. So don't get confused, guys, with the name there. Mandibular foramen is not allowing the mandibular nerve to pass through that. Mandibular foramen is actually providing inferior alveolar nerve as well as the inferior alveolar vessels to pass through that one. That's the reason why I hope now you are getting it, okay, why you should learn about the maxillary artery and its branches. So all these branches has got some or the story, some or the other story associated with that one. So you have to remember about all these branches. Come on, so successfully we have completed everything regarding the first part of the maxillary artery, giving 5 branches. made. Now welcome to the second part. Second part will also give you 5 branches, but those 5 branches are very much easier, guys. We can remember this easily here. This is like my favorite part. Now why I'm telling you like this, it is easier here. Why? Because it will give 5 branches, but all those 5 branches are muscular branches. That means they are supplying to muscles. And which muscles? Muscles of mastication. So when it is to muscles of mastication, try to recall, you have got masseter, you have got temporalis, and the lateral pterygoid and medial pterygoid inside. The masseter, temporalis, lateral and medial pterygoid inside. So therefore, there will be one artery which is given to masseter. So artery to masseter, and then there is one artery which is given to lateral pterygoid. Artery to lateral pterygoid muscle. And then there is one more artery which is given to medial pterygoid. So artery to medial pterygoid muscle. Medial pterygoid muscle. And then there will be like one more artery to temporalis. And let me do it like this here. To temporalis muscle, actually there will be 2 arteries, sir, and those 2 arteries will be, there will be 2 deep temporal arteries. There will be 2 deep temporal arteries here. Now why is the name given like this? Try to understand here, guys. This is the temporalis muscle, and those 2 arteries are not going from the superficial part of temporalis, they are going from deeper part, from inside. That is the reason why the name of the artery is deep temporal artery, and that too they are 2 in number. It's a big muscle, 2 arteries are supplying there. So 2 deep temporal arteries, and then artery to lateral pterygoid, medial pterygoid and masseter. So in total 5 branches given from second part. Easy to remember, and that is the only thing which is easy to remember there. Otherwise the first part and third part you got to memorize a lot. Now welcome to third part. Now what are the branches given from third part of the maxillary artery? There are totally 6 branches given from here, and those 6 branches we are actually going to remember with the help of a mnemonic here, and that mnemonic here will be PIG, pig pass. Remember with the mnemonic as pig pass here, guys. So let's first of all write down all the 6 branches here. Number 1. So P stands for posterior superior alveolar artery. Posterior superior alveolar artery. Number 2, I stands for infraorbital artery. And then number 3, it is important one here, G stands for your greater palatine artery, guys. Greater palatine artery. Now why I'm telling you it is an important one, try to recall from your ENT. I think you have learned about the Little's area in the nose. Okay, you have actually learned about the Little's area, and one of the artery contributing to that Little's area will be the greater palatine artery, and that is actually a branch from where? Maxillary artery. Which part? Third part. So third part of the maxillary artery will give greater palatine, and greater palatine in turn will be contributing to the Little's area. Then the next one here, pig, we have completed the PIG, and then pass, the fourth one. And then P stands for pharyngeal artery here, guys. P for pharyngeal artery. And then A stands for artery to pterygoid canal. Artery to pterygoid canal. I hope you also remember from the cranial nerves we have discussed somewhere about the nerve to pterygoid canal also, Vidian nerve. So similarly the artery to pterygoid canal, and then finally S here, S stands for sphenopalatine artery. S for sphenopalatine artery here, guys. And even this is also very much important, put a star mark there. Why? Because that is also contributing to the Little's area. Fine. So the arteries which are contributing to the Little's area, we actually have got 2 of them over here, greater palatine artery as well as the sphenopalatine artery also. So these 2 arteries are going to contribute to the Little's area. Keep that thing in mind. Now, if you now count all the arteries here, all the branches, maxillary artery in total, first part will give you 5 branches. First part will give you the 5 branches here. Second part will also give you 5 branches, in total 10. And the third part will give you totally 6 branches. And in total, there are 16 branches given from maxillary artery. And you know what was the question in the exam? Once they have asked, out of these 16 branches, which is the largest one? So remember, out of all these 16 branches, the largest one will be the sphenopalatine artery. The largest branch will be the sphenopalatine artery. And I hope you also remember Sphenopalatine artery, it is also known as the artery of epistaxis. Artery of epistaxis, the bleeding from the nose bleeding. So sphenopalatine artery is also known as the artery of epistaxis over there, guys. Perfectly done. So that is about the maxillary artery, divided into 3 parts, and all the branches of maxillary artery done comfortably and in a crystal clear manner. Now after completing about all these arteries over here, let me discuss one important MCQ which was asked in the AIIMS exam, guys. Now for example, if this one is your nose here, and imagine this one here to be the palate, obviously there will be hard palate first, followed by the soft palate, whatever. Now greater palatine artery is actually coming from here, and after coming from here it is traveling in this manner, and via a foramen it is entering here and contributing to that little's area. Okay, that is about the greater palatine artery. And then the sphenopalatine artery. Okay, at the end you'll be getting a beautiful conclusion, guys. Look here very carefully. Sphenopalatine artery, even sphenopalatine artery is also contributing. Sphenopalatine artery, it is also the one which is contributing to the little's area. And not only that, if you have learned about the facial artery will give a branch to the upper lip here, and to the upper lip it will be actually known as the superior labial artery, and that superior labial artery will also contribute here, guys. Superior labial artery, I'm just writing here, and that will also contribute for the little's area. It is just a schematic diagram here, sir. And finally, apart from all this, even the ethmoidal arteries will also contribute for the little's area, guys. Now the question that was asked in the AIIMS exam, observe very carefully here. It is not about like which arteries are contributing to little's area. Hold on, have some patience here. Okay, so this one is the little's area, which is also known as that Cahill's-Bax plexus. Now, like previously they were asking the questions like which arteries are contributing to little's area. Now every student is just mugging up superior labial artery, ethmoidal artery, sphenopalatine artery, and then the greater palatine artery. These are the arteries which are actually contributing to the little's area. But that was not the question in the AIIMS exam. The question in the AIIMS exam was, all the arteries which are contributing to little's area will be from external carotid artery except one. Oh my god. That means just mugging all these arteries and their names is not going to help you nowadays. Nowadays more in depth. Come on. Let's see the conclusion. Superior labial artery, it's a branch of facial, and I just made you write down facial artery is in turn a branch of external carotid artery. Out of that 8 branches, one of the branches facial. Greater palatine artery is a branch of maxillary artery. Just now we have learned that to the third part of the maxillary artery. And in turn maxillary artery is a branch of which one only? External carotid artery. Sphenopalatine artery, that is also a branch of maxillary artery only. Third part of the maxillary artery, and maxillary artery is in turn a branch of external carotid artery. Okay, and now the last and final thing here, ethmoidal. Remember, ethmoidal artery is the one which is a branch of your internal carotid artery. It's a branch of internal carotid artery. So therefore, the question asked in the AIIMS exam was, the arteries which are contributing to little's area, all of the following are from external carotid except one. So remember, all the arteries contributing to little area is from external carotid artery except the ethmoidal. Ethmoidal will be from the internal carotid artery, guys. Awesome. Lovely question here. So that's a beautiful question asked in the exam. So please take care about that. And that is the reason why I am trying to connect with the little's area concept over here itself along with the maxillary artery. I hate just simply mugging up the branches. I have seen students writing the branches, mnemonic, and mugging up that one. I really hate that. There is some concept behind that. That's the reason why they are testing in the exam. It's not simply like just mugging the branches. So even the subject like anatomy can be made like more conceptual here. So try to learn in this manner, guys. Perfect. Now after completing the external carotid artery and all the branches and the maxillary artery and all branches, now let us go to another important artery which you have to know here, and that artery will be the facial artery, guys. It is also a branch of your external carotid artery only. So now welcome to the facial artery. Now facial artery, this is like a little bit easier topic compared to external carotid and maxillary artery, but even though it is easier, important one. So now do one thing, guys, look at this beautiful diagram on the screen there and simultaneously look at me here. Okay, external carotid artery will give a branch, and that branch will be facial, and facial artery will be first lying in the submandibular region here. And from this submandibular region, the facial artery will take a turn. Okay, and it will take a turn at the base of the mandible here, and after taking a turn, it is going to enter into the face. And in the face, the facial artery is actually going to move obliquely like this, and finally go and end towards the medial angle of the eye here. I repeat the entire course, simultaneously look at the screen also, guys. Facial artery is first traveling in the submandibular region, then taking a turn, and then entering into the face, and then going obliquely here and ending near the medial angle. So if you want to see in the diagram here, in this diagram, external carotid artery, and that is going to give rise to this facial artery first lying in the submandibular region and then taking a turn and going obliquely like this. Perfect. And now let's learn about this one perfectly, guys. So the next artery that we are going to learn in the line is facial artery. Now, as I told you, whenever you're learning about any artery, first of all, write down there, it is a branch of which one? Remember, facial artery, it is a branch of external carotid artery. Now, after that, guys, the next thing that we are going to learn, the entire course and branches. Let's see the entire course of the facial artery as well as the branches given with the facial artery. And to learn that, we'll do one thing. We're not going to simply learn it like the branches with the mnemonic and all. Let's draw the diagram. Let's make the things a little bit interesting here. So imagine this one here to be someone's face. I don't know exactly. And then this one here, the external carotid artery. And the external carotid artery will actually give a branch, that is facial artery. And facial artery is first going in the submandibular region and then gonna take a turn. So after taking a turn, entering into the face, and in the face it is moving in a tortuous manner, ending near the medial angle of eye. That's the entire course of the facial artery, guys. So it's so simple. We have done the entire course in the diagram itself here. So first lying in the submandibular region, then taking a turn, and then entering into the face. In the face, moving obliquely and ending near the medial angle of the eye. Perfect, sir. The course is done. And now let us see the branches given with the facial artery. Facial artery will give the branches in the face as well as it will be giving few branches in the neck region also. So let us divide those branches, guys, into two categories. First, the branches which are given in face. Let us see what are the branches given by facial artery in face. Now while moving up obliquely over here, it will be giving one of the branch to the lower lip, and to the lower lip it will be inferior labial artery. It's inferior labial artery, number one. And then it will also give a branch to the upper lip, and that branch will be the superior labial artery. Superior labial artery, and that is what I told you just now. Okay, superior labial artery is the one which is contributing to Little's area. And little bit above, moving up, it will be giving few branches to the lateral wall of the nose. So those are nothing but the lateral nasal branches. And finally near the medial angle, near the medial angle here, and that one will be the angular branch or the angular artery, whatever. So these are the four branches which are given in the face. So inferior labial artery, superior labial artery, lateral nasal branches, and the angular branch. It's nothing difficult, I hope so. It's so much meaningful here that you can easily remember. Now once you are done with the branches in the face, now welcome to the branches given in the neck region here, guys. So in neck, I'm just writing here. Now what are the branches given by the facial artery in the neck region? And those branches we are going to remember like T, A, G, S, tags. So nowadays it is a trend on online tagging. So we are going to tag like 4 branches in the neck region. So tags. So T stands for tonsillar artery. Tonsillar artery. And then A actually stands for the ascending. Now be very careful here. It's ascending palatine artery. Ascending palatine artery here. Somewhere we have learned about the ascending pharyngeal artery also, but this one here will be the ascending palatine artery. And then G stands for glandular artery, to the glands, and then S stands for submental artery. Submental artery, guys. So T for tonsillar artery, A for ascending palatine artery, and G for glandular artery, and then S stands for submental artery. So we are going to tag like 4 branches in the neck region from facial artery, guys. Perfectly done. So that completes the entire course of the facial artery, and as well as that completes the entire branches of the facial artery. Now after completing the entire course and the branches, now let us see certain important MCQs here guys. So as usual, our same habit every time, please add a note here. After completing the topic, let's see the MCQs possible. Note number 1, remember that facial artery is a tortuous artery. Facial artery is one of the examples of tortuous artery, sir. Now I hope you can clearly see in my diagram itself, while moving up, the facial artery is not going straight there guys, it's actually very much tortuous here. Now what is the reason why it is tortuous? It's very simple. The facial artery is more nearer to your mouth here. This opening here, mouth, it is more nearer to that one. And suppose if the artery would have been straight here, the moment you open your mouth widely, the artery would have been ruptured. That's the reason why God has made this artery already tortuous and you are allowed to open the mouth as much as you want. Okay, artery is tortuous. Now you might be thinking, what is this silly thing here? Is this important for our exam? Yes. Why? Is the facial vein also tortuous? No, not at all. Only artery is tortuous, but not the vein. So please make a note of that. Only facial artery is a tortuous artery, not the facial vein. Facial vein is not tortuous, and that was tested in the exam. Take care, guys. Why the vein is not tortuous? Simple. It is not nearer to your mouth side. It is a little bit away from the mouth. That is why the facial vein is not tortuous one. Wow. And after this, what is the next thing that you have to remember? Where exactly is facial artery taking a turn here? We know that facial artery is taking a turn here, base of the mandible here. But where exactly it is going to take a turn? So guys, what is this muscle of mastication present over here? This muscle of mastication which is actually present over here will be the masseter muscle. Everyone knows that. Let me just draw that with another color here. So you just imagine here this one like your masseter muscle over here guys. Masseter muscle. And you can clearly see the facial artery is actually going to take a turn near the anterior border of the masseter, and not only the complete anterior, only the anterior-inferior border. There the facial artery will be actually taking a turn. So please make a note of that. Number 2, facial artery turns at antero-inferior border of masseter. Antero-inferior border of masseter. That's an important location. Sir, where the facial artery can be palpated against the bone. So facial artery turns at antero-inferior border of the masseter. Very much important point. Now after completing this one, like anything else that is more important here? Yes, I'll tell you one more important point here. The angular branch, one last and final point, sir. The angular branch is actually going to form an anastomosis here with a branch or with an artery that is known as dorsal nasal branch. So dorsal nasal artery or dorsal nasal branch is going to form an anastomosis over here. Name is very much easier guys, nasal, dorsal nasal, fine, we are able to remember that one. But the biggest question mark in our mind right now, so this is actually a branch of which one? It's coming from where? So remember, dorsal nasal branch is in turn a branch of your ophthalmic artery. And we all know very well, ophthalmic artery is the first branch of internal carotid artery. Ophthalmic artery is the first branch of internal carotid artery. My goodness, look at that beautiful thing here. It means that the internal carotid artery and external carotid artery are going to form the anastomosis near the medial angle. And you know the arteries or the branches which are involved in that one very clearly in this diagram here. So internal carotid artery giving ophthalmic artery will in turn give you dorsal nasal branch, and that is going to form the anastomosis with the angular branch, which is actually coming from the facial artery is in turn a branch of your external carotid artery. So therefore we can just say directly that the external carotid artery and internal carotid artery, both of them are going to form the anastomosis near the medial angle of the eye. Perfectly done. So that completes everything to be remembered about the facial artery. It's coming from where, what is the entire course, what are the branches given in the face and in the neck, and after that certain important MCQs which has been tested in your exam. Take care about that. So that completes about the facial artery, and now we'll be moving towards the next one, that is your subclavian artery, the last in the line to be studied in head and neck topics.